So I'm going to talk to you today about lessons in public health advocacy and my personal journey. My name is Dr. Aseem Malhotra. I am a consultant cardiologist. I have a number of different roles, including being a trustee on the board of trustees of an independent health think tank in the UK called the King's Fund, which advises government on health policy. So for me, my journey started really in highlighting and being advocate for tackling how we can tackle the obesity epidemic in the UK, and I know in the US the statistics are pretty startling. More than 2/3 of adults are overweight or obese, and the trend suggests this is going to significantly get worse in the next 30 years. More disturbingly for me, 1 in 3 children by the time they leave primary school are also overweight or obese, and the costs to the National Health Service are about £5 billion at the moment, and they are projected to increase to 10 billion. But as many of you will understand and know, that the bigger issue, the more important issue, is type 2 diabetes, and the costs to the National Health Service and to the economy due to lost productivity combined now are around £20 billion per year, and this is projected to hit £40 billion per year by 2040 if we fail to act. And at the root of the problem, I think we shouldn't forget that this is essentially an environmental problem. Ultra-processed junk foods essentially have become unavoidable wherever you go, whether it's at the gas station, whether it's on the high street, even in gyms. These foods have become have saturated the food environment, and again makes it difficult to make healthy choices. But for me, the biggest scandal, and where my journey initially started, was the fact that we've even allowed our hospitals to become a branding opportunity for the junk food industry. And the problem here is that it actually legitimizes the acceptability of these sorts of foods. So a study carried out in the United States looked at pediatric institutions that had fast food vendors on site, and they found that people that visited the hospital were four times more likely to purchase junk food when they left the hospital compared to people that didn't go to the hospital in the first place, people who were just visiting the hospital. So there is a subconscious legitimacy and acceptability that has been given to these foods. The fact that we've even got them in our hospitals is really quite extraordinary. So in an attempt to start making some progress in combating this obesity epidemic, I wrote a piece in the Observer newspaper in 2011, which became a front page commentary at the time, and really pointed out the fact that I'm a consultant cardiologist and I'm treating patients in my hospital. I'm doing emergency stenting in the middle of the night, and then our patients basically the next day are being served junk food. I remember a case of a man in his 50s who we treated with a stent for a heart attack, and the next morning on the ward round, he, as I'm talking to him about taking his pills regularly and stopping smoking, etc., and I talked to him about following a healthy diet, he gets served a burger and fries. And he looks at me and says, "Doc, how do you expect me to change my lifestyle if you're serving me the same crap that brought me here in the first place?" So I wrote this piece in the Observer, and it had quite a good impact. And following up from that, I then wanted to make sure that this became, part of policy amongst some medical professionals. So I was part of a group called the Academy of Medical Royal College's Obesity Steering Group. I was invited there as the only junior doctor on the group to produce a plan of what government and doctors need to do to curb the obesity epidemic in the UK. And one of the, there was, although there were differing views on various aspects of what needed to be implemented, certainly there was a consensus of opinion amongst the doctors that at the very least we should be getting junk food out of hospitals. So that became quite a prominent story when we came out with our plan. That was one of our 10 points. And that was in the early 2013. And then shortly after that, having got that approved by the Academy of Medical Royal Colleges as part of policy that, this is what doctors support as a group, I then went and spoke at the British Medical Association annual conference, and a motion was put forward by myself that the BMA also should agree that we should not be selling junk food in hospitals. And simultaneously at the same time, I managed to time writing a commentary for the BMJ that it's time to ban junk food on hospital premises, citing my perspective, but also evidence for why this is, a really important thing to do. And it made news at the time, and my BMA conference motion got passed with an overwhelming majority, and it was picked up by the Guardian newspaper. And I think that was a good lesson for me in the role of advocacy, and also use of the media really to get attention on an issue. Moving forward, more recently, I had my local hospital in response to much of the work I'd been doing on advocacy for reducing sugar consumption, also managed to introduce low carbohydrate diets into the canteen for the staff. And that was partly based upon the fact that the head chef, who was previously a type 2 diabetic, who had also read my work and got in touch with me, he wanted to make sure that low carb options were available for the staff as well, because he understood the science. It worked for him. And again, this was certainly a very good start in making progress to improve the food environment, especially in hospitals. To put things in perspective, and of course varying debates about how important is diet in health. For me, I think it is the most important issue of our times right now in terms of driving chronic disease. And certainly the Lancet Global Burden of Disease report suggests that poor diet now is responsible for more disease and death than physical inactivity, smoking, and alcohol combined. And I think the bigger issue, I know many people at the who are listening and watching my lecture are already converts to the low carb way of living. But I think the big important issue from a population health perspective, and of course I'm certainly a big advocate for use of low carbohydrate diets for treating many conditions, especially obesity, especially type 2 diabetes, is that ultra processed foods have now become half of all UK family purchases in the UK. So I think the bigger issue we should be concentrating on is ultra processed foods on a population level. And Carlos Monteiro from Brazil has done a lot of work and developed something called the NOVA classification, which I recommend you all look up. It's free, available online, and that really puts various foods into groups based upon the level of processing, and highlights that ultra processed foods in particular are strongly linked to obesity, chronic metabolic disease. And this should be the focus for governments to try and reduce the consumption of it. And it is quite pretty extraordinary that we've allowed this to become so normalized as well. One of the things I personally do when I speak to patients, and again, this is mentioned in the NOVA classification, is if it has 5 or more ingredients essentially and is industrially produced, it comes out of a packet, it's ultra processed. So I think that's a really I believe a good, useful public health messaging campaign should be for the public, that if you go into a supermarket or a shopping mall or whatever to buy your groceries or buy, whatever you're eating, if you look at the packet, it has 5 or more ingredients, it's ultra processed, it's best avoided or certainly eaten as an occasional treat. It should certainly not make up half of your diet. Publication, the BMJ actually looked at how do various food groups contribute to ultra-processed food, and not surprisingly, for people like myself, having looked at this for a long time, most of it is processed carbohydrates. So it's coming from sugar and starchy foods, most of it. Of course, there are processed meats and there are dairy products and ultra-processed fruit and vegetables as well. But again, even there, most of this is being driven by sugar and starch. And if we really want to make an impact on population health, that's where I come from as a public health advocate, because we don't live in cocoons. We function in a society, and if our healthcare systems are under great pressure, we're all affected ultimately. And of course, this is about justice as well for people who don't have access even to the kind of education that many of you listening to this talk have. So we want to make the default choice the easy choice. And Tom Friedman's Health Impact Pyramid highlights that actually socioeconomic factors are the biggest driver of health. But then after that, which is where we come in with the food environment, it's about making the environment healthier. And in fact, history shows us that the biggest impact on health and the population has come from actually regulations and legislation. We've taxed tobacco, smoke-free buildings. Just some very good example of the impact that has had, and the biggest impact on reducing cardiovascular disease death rates in the population, certainly in the last 3 or 4 decades, has been from reduction in smoking prevalence. And the reason that this works is these policy-based interventions tend to be more effective because they reach all parts of the population and they're not being dependent on a sustained individual response. And of course, education is going to have minimal impact when the food environment is working against you. We want people to swim with the current, not against it. And that's really what we're fighting against at the moment. Now, I've become well known in the UK for my advocacy on reducing sugar consumption, and a little bit of history here is that people were aware, certainly scientists were aware of the harms of excess sugar consumption going back even to the 50s and 60s. And Professor John Yudkin, a nutritionist, wrote a book called Pure, White and Deadly in 1972. And at the time, Ansel Keys, an American scientist, was arguing that saturated fat was responsible for the increase in the prevalence of coronary heart disease, certainly from in the early 1920s all the way up to 1960, 1970 when it peaked. And Yudkin said it wasn't saturated fat was a major issue, it was sugar. But sadly, Yudkin was hung out to dry because he was up against very powerful sugar and processed food industries that use various methods. And I do recommend, if you haven't read his book Pure, White and Deadly, it's a fascinating read about his own insights into sugar and its negative impact on health and his patients. And but unfortunately, he was hung out to dry. And Ansel Keys won the argument about saturated fat, which we now know has already been debunked in terms of its as a causative factor in coronary artery disease. And again, the food industry was successful. They discredited the case against the sugar. Yudkin died in 1995, and his warnings were no longer taken seriously until Professor Robert Lustig, pediatric endocrinologist at the University of California, San Francisco, came on the scene. And his YouTube lecture, which has now got over 8 million views, is he really started the ball rolling again and getting awareness on sugar. He also wrote an editorial in Nature a few years later, which I became very interested in because it seemed to make sense to me what he was saying, that we need to regulate sugar. And some of the things that certainly resonate with me as a cardiologist is the fact that the real issue for heart disease is metabolic syndrome, and which is synonymous with insulin resistance syndrome. 2/3 of people admitted with heart attack now have metabolic syndrome, and that is associated with increased mortality versus people that don't have it. And the data seems to be quite clear to me that independent of calories, sugar consumption, in particular fructose, was a driver of liver fat accumulation and insulin resistance and metabolic syndrome, and therefore this should be something that needed to be curbed. Independent even metabolic syndrome, we know that sugar is one of the only things we consume that's directly toxic to teeth enamel. In the UK, the most common cause of hospital admission in young children is tooth decay, and it's the most common cause of chronic pain as well. So it's not just the fact that it's the metabolic role of excess sugar consumption, but certainly it has other adverse effects on health as well, which need to be highlighted. And again, the other issue which I certainly resonate with is that this isn't really about obesity. Obesity is a marker of a much bigger problem. At the root of it all is insulin resistance, and that starts in people even of normal body mass index, and up to 40% of people with a BMI of less than 25 will harbor metabolic abnormalities to the same degree of people with obesity, and this includes pre-diabetes or type 2 diabetes, hypertension, and cardiovascular disease, as well as probably linked to dementia and cancer as well. So once I became aware that sugar had clearly we were consuming too much sugar, I then tried to look up any guidance anywhere about how much we should be consuming as a limit, and I came across this paper by the American Heart Association published in 2009. And what was interesting is they suggested that actually the average male in the US should consume no more than 6 teaspoons of sugar a day, the average female about 6. And interesting, within that paper that wasn't highlighted in any public way, I found that the US Department of Agriculture said for the average 4 to 8 year old child, they should be consuming no more than 3 teaspoons of added sugar. But in the UK and in Europe, there was no actual sugar labeling in the US, which I'll talk about briefly in a second. The sugar labeling was extremely misleading. So if you picked up a can of Coca-Cola, I looked at this, it actually says on the label this is 35 grams of sugar, which is almost 9 teaspoons. But it says on the GDA, this is 39% of your guideline daily amount. What does that mean? In essence, it suggests that you can be consuming, if you extrapolate that from 9 teaspoons to 39%, it actually suggests that you can be consuming 22.5 teaspoons of sugar a day as part of your guideline daily amount, not as a limit. So I tried to investigate this a little bit further, and I found that the World Health Organization in 2003 had recommended that no more than 10% of our energy requirements should come from from sugar, from added sugar, and 10% should come from intrinsic sugars, essentially encouraging people to eat more whole fruit and vegetables, which I didn't think was a big issue. And but the problem with this labeling is it's misleading. It doesn't actually reflect that advice. Interestingly, in the US, sugar is not considered a nutrient at that point. Therefore, there was no GDA. There's no guidance for sugar on labeling at all in the US, and therefore it makes it very difficult for consumers to understand how much sugar they're consuming, especially as a third of sugar consumption comes from sugary drinks that people would associate with being unhealthy, and junk food about 6%, but almost half of sugar consumption was coming from foods that people would not necessarily associate with having added sugar, such as ketchup, salad dressings, bread. The US Department of Agriculture also, when I was looking at this, had removed a published database. So there was something that people could go to initially to look at how much sugar was in various foods, but it was removed because the food industry were not very happy, and they said that it was very difficult to extrapolate exactly how much sugar they were adding into the foods as well. So, to be honest, when I was discovering all of this, I was very concerned, clearly as a doctor, that, we were all being sort of misled on the science of sugar and how this was impacting on public health. So I started looking up what food industry had been doing really to hinder progress in tackling the obesity epidemic. One paper which I came across was one written by Professor Carly Brownell from Duke. And it's a great paper, a very inspiring paper, entitled "Big Tobacco Played Dirty and Millions Died: How Similar is Big Food?" And he really compared what the food industry had been doing to stop real interventions to tackle obesity with tobacco. And one of the things they talk about is personal responsibility. The reason that you're overweight is because it's lack of personal responsibility. Of course, raising fear that any government intervention is usurping personal freedom. But again, we have to remember the biggest public health successes that have happened in the last century really have happened from regulation, whether it's about safe drinking water, seatbelts in cars, smoke-free buildings. And also the food industry engaged in corporate social responsibility. Also, the soft drink industry, for example, paid the Children's Hospital of Philadelphia $10 million when they were considering a sugar drinks tax, and they won the argument, and they were able to do so to suggest this wasn't necessary, and this was a part of the nanny state. And of course, I and many colleagues in this space have also been subject to this, is that we get criticized of being food fascists and leaders of the nanny state, food police, etc. The other thing they do as well is any studies that really look like they're hurting them, they will call them junk science. They emphasize physical activity over diet. That's been something that for a very long time people have thought that the obesity epidemic has been driven by lack of activity, when the evidence suggests actually, although activity is very good for health, it's pretty ineffective when it comes to weight loss. It has to be focused on diet. And, it took 50 years from the first links between smoking and lung cancer before we had any effective strategies to tackle tobacco consumption, because the tobacco industry engaged in a corporate playbook of planting doubt, denial that cigarettes were harmful, confusing the public, and even buying the loyalty of scientists. And even as late on as 1994, the CEOs of every major tobacco firm went in front of US Congress, and they swore under oath they didn't believe that nicotine was addictive or smoking caused lung cancer. So I put all of this together in a piece, commentary that was commissioned by the BMJ, and this investigation that I carried out really to highlight this problem that we need to, sugar needs to be the priority in terms of its consumption. It was driving chronic metabolic disease. People were being deceived, and I called on the Scientific Advisory Committee on Nutrition in the UK and the European Food Standards Agency to really look into this again and to revise their guidance on sugar. It was press released by the BMJ, and I got some supportive quotes as well from a number of prominent doctors. It was picked up by the UK press. LA Times mentioned it, and also BBC Breakfast. And I was, this is the most watched breakfast TV program in the UK, and I had a primetime slot. And I explained this issue about sugar. It was interesting. At the end, the presenter said we should add that we did ask 10 different companies or organizations associated with carbonated beverage, supermarkets, sugar manufacturers, etc., to discuss this with Dr. Malhotra. All of them were unavailable. I wonder why that was. And then several months later, I wrote another editorial which became even more widely publicized, really focusing on the fact that saturated fat did not seem to have a clear link with heart disease. Again, we should really focus on sugar. And also refined carbohydrates, the consumption of which were driving obesity and type 2 diabetes, or certainly was a big factor and was being ignored. And of course, as you know, the dietary guidelines had been putting refined carbohydrates, starchy carbohydrates, certainly at the base of the diet, which was detrimental in my view. And that became very widely publicized in a much bigger way. It was a front page of 3 British newspapers. I was on CNN International. I was on Fox News Chicago. It was I think it was, although very controversial, certainly did help shift the focus in a big way to sugar again. And in this whole time, I was being contacted by various scientists saying we should form a group called Action on Sugar. I became the science director, and then we decided that we got a number of scientists with credibility, including my friend and mentor, who I got to know, Professor Robert Lustig, to form Action on Sugar, and then we hit the ground running. So January 2014, very big news story in the UK. It dominated all the news, and the front page of the Daily Mail was "Sugar is a new tobacco." And everything was going well. We even had political support. The chair of the all-party diabetes group, Professor Keith Vaz, MP, he actually came out in support and put an early day motion in Parliament saying that we want to get lots of MPs signing up that sugar reduction should be a priority now in the UK, which needs government involvement. But a few days later, what happened, and of course this is just highlighting all of the press, a lot of the press that we got around this, which was pretty amazing. In the front page of the New Scientist was, based upon the work we'd done. We had the Health Secretary, Andrew Lansley, get up in Parliament and said that he was dismissing Keith Vaz's sort of attempts to say that sugar was a new tobacco, and he said that this is not appropriate. He said sugar is essential to food. So I got up in Parliament and said sugar is essential to food. I then was able to write a commentary in the Observer newspaper several days later, which was called sugar is now enemy number 1 in the Western diet. And what I did is I highlighted that this he said this sugar is new tobacco analogy was inappropriate. And I said that Lansley compounded his errors by ignorantly asserting in the House of Commons in Parliament that sugar is essential to food. It is not. He would have been more accurate in saying sugar is essential to food industry profits and lining the pockets of its co-opted partners. Lansley himself was a paid director of marketing company Profera to the end of 2009. Profera's clients have included Pepsi, Mars, Pizza Hut, and Diego's Guinness. Well, we didn't hear from Andrew Lansley again. And again, this also highlights that sunlight can be a very potent and powerful antiseptic against malodorous health policy, and there's no greater way to get attention on an issue than media attention. The following week, we found that the Scientific Advisory Committee on Nutrition, the head had been working, or certainly received research funding from Coca-Cola and Mars, which may have hindered his action on, certainly taking action on sugar. And we found that 5 of 8 people, this was exposed in the Mail Online, of that committee, were actually had worryingly close ties with sugar manufacturers. So moving forward, the new Secretary for Health then called us Action on Sugar. I was the Science Director of Action on Sugar to discuss what needs to be done to tackle child obesity, which was great. And then after that, as many of you know, we had a sugary drinks tax launch. So I think certainly in the UK there's still work to do, but we've kind of we've gone over the mountain now. We've tipped over the edge, and I think that the sugar sort of action on sugar, collectively, the awareness is huge. So I think that we are going to make considerable progress, certainly in getting sugar consumption down. Let's talk about statins, and certainly my role around statins. Many of you may know that I've also become well known about being an advocate for greater transparency in prescription of medications, particularly statins. So in 2013, John Abramson at Harvard wrote a paper with colleagues really highlighting that there was no mortality benefit from taking statins at low risk of heart disease, and you would have to treat 140 people at low risk, people less than 10% risk, over 5 years to get a benefit in preventing a non-fatal heart attack or stroke, but there was no mortality benefit. But 1 in 5 people actually develop significant side effects. This is also something that I pointed out in my editorial on saturated fat as well, and it got called for retraction by the head of the Clinical Trials Service Unit in Oxford, Professor Sir Rory Collins, who was quoted in the Guardian front page story when the BMJ editor refused to retract the pieces. He said that actually 1 in 10,000 people got any significant side effects. The articles went for review and whether they should be retracted because the BMJ editor was put under pressure. And fortunately, it came back 6-0 in our favour. There was no need for retraction. About the 1 in 5, he said that of course it was much less. And we'd quoted observational studies, and randomised controlled trials are the only way to really truly determine side effects. And then they published another review, Professor Collins in The Lancet, in 2016, and suggesting that, because of a lot of media attention that had carried on since then, that actually side effects were still rare, that he reanalyzed his own data. And then the Sunday Times did an investigation in 2016, which was really quite extraordinary. And this is some excerpts from the Sunday Times investigation, which revealed that this is actually from the Sunday Times, that Professor Collins himself was actually co-inventor of a test that tells you whether you're going to get side effects from statins. It's particularly muscle symptoms. It was being sold in the US directly to the consumer for $99. And the marketing material also claimed that 58% of patients on statins stopped taking them within a year, mainly because of muscle pain, which I found quite extraordinary. Collins himself said that this was misleading. He hadn't taken any personal money. But Boston Heart Diagnostics, who had license for this particular device, they said that his claims were incorrect, and they stood by their own, saying that his randomized controlled trials had excluded people with side effects. A Freedom of Information request by the chief reporter of the Sunday Times who did the story to Oxford found that they did receive around just over £300,000 from the sale of this kit, and over 100,000 went to Professor Collins' department. So this is all quite puzzling, really, especially as he said that side effects were rare. He also filed this in 2009, 4 years before, he filed the patent 4 years before our pieces were published in the BMJ. I've written a book called The Pioppi Diet, which was released in the UK in 2017. Essentially, it's a low-carb Mediterranean diet combined with lifestyle approaches really to target insulin resistance and chronic inflammation. It got endorsements from many leading doctors because I knew that I was taking on the establishment here, and it was good to just try and get them involved to try and shift the paradigm and the understanding towards accepting low-carbohydrate approaches being effective and safe to manage people with obesity and type 2 diabetes and cardiovascular disease. The most prominent person in the UK advocate of this is now the deputy leader of the opposition party at the moment, called the Labour Party, Tom Watson, and he lost 100 pounds just following my particular diet plan. He'd been significantly overweight for a long time. He's given his own endorsement for the book. And again, it's based upon, really the science is based upon an editorial I wrote with Rita Redberg and Pascal Meyer, both editors of medical journals, both cardiologists, really to shift the focus on our understanding of heart disease. And the editorial itself has now had more than 1 million views. I think it was the most, it broke records for the British Journal of Sports Medicine, and certainly generated a lot of interest, which I was very pleased about. There was a lot of media attention on this, particularly on this issue, and we said we need to focus away from saturated fat and concentrate on insulin resistance and systemic inflammation, and encourage people to be regularly active and reduce their stress, etc. And if we do that, then we're going to have a much bigger impact on heart disease than just prescribing statins. The British Dietetic Association had come out and suggested that the book was one of the worst 5 celebrity diets to follow in a BBC News story, but unfortunately they'd used lots of distortions. I hit back in a long read in Men's Health, highlighting that the spokesperson for the British Dietetic Association, Sean Porter, basically had made false statements saying that we had cherry-picked evidence and we were advocating a high consumption of saturated fat, which we had not. And in fact, we'd used systematic reviews, which was pointed out in the British Journal of Sports Medicine. It was interesting also to note that Sean Porter, this was not declared on the BBC story, was also a consultant dietitian to the British Fruit Juice Association. And, I am somebody that in the diet plan advocated a sugar-free approach also for people to improve their health. So again, maybe a conflict of interest there from Sean Porter, but certainly I think that should have been made publicly available. People should have known who's making these comments. And it made me think of quite an amusing tweet by John Cleese, who, as many of you may be aware of, was one of the men involved in Monty Python. And it made me, one should never forget the first principle of the old KGB, always accuse your enemy of exactly what you are doing. The Pioppi Diet became very successful. It was a bestseller in the UK. It became an international bestseller. And I was asked to give talks about the book and the science behind it. And just to point out at this point, I'm not making any money from the sales of the book. I'm donating all personal royalties from the sale to charity. Tom Watson, obviously we made the book again more prominent, and I was invited to speak at one hospital, and the chief executive of government body Public Health England called up the chief executive of the hospital and suggested not to give me a platform to speak, and certainly should not be endorsing the Pioppi Diet. And this was exposed in the Sunday Times, that I was being attacked in this way, and they were actually trying to get several people to endorse the book to dissociate themselves from it. Fortunately, those people stood firm and did not. Tom Watson, the deputy leader, said that it seems extraordinary that a government agency responsible for helping us get healthy has tried to close down a respected cardiologist who just wants to make people well. If they disagree with him, debate with him, but don't silence him. And this paper, which I think is really useful and interesting for you to read, just to think about the bigger picture when we're trying to create a revolution or change things. This was written by Simon Chapman, who is a professor of public health in Australia, and he's considered probably the most significant individual person in terms of highlighting the harms of tobacco consumption. And this paper, again, which is open access, he talks about his own career in public health advocacy and all the, there's 10 pieces of advice that he gives in that. But one of them is grow a rhinoceros hide as well. Sorry, I'll come on to that. So I would just stop on that bit. So I'll rewind again. So he gives a number of different pieces of advice in his career in public health advocacy, and these include always respect the evidence, and if the evidence changes, so should you. Be clear and concrete about what you want to change and support. Study the media, use killer facts. Values are everything. If people care about something, they care about an issue, then you're going to have much bigger progress. And certainly highlighting the misdemeanors of the food industry does get people angry, and it's not done without facts, and it's actually quite clear that's what's been going on. Experts are fine, but they're not a living thing. Of course, case studies and people relate to other human beings. So those stories, those personal stories of people, for example, that have improved their lost their weight by low carb, etc. Those personal stories are much more powerful than just an expert citing off academic literature. Use social media a lot, and of course be patient. Successful advocacy does take time. It may take 2 or 3 decades before we get any significant impact. The problem is we don't have that much time. But one of the final points he makes, and one of his lessons, is grow a rhinoceros hide. He says, unless you're an advocate for an utterly controversial policy, as soon as your work threatens an industry or an ideological cabal, you will be attacked, sometimes unrelentingly and viciously. And moving on, only most recently, myself and a number of other advocates and people I respect a lot, Malcolm Kendrick, who's a GP, and Dr. Zoe Harcombe, were attacked in the Mail on Sunday newspaper in a prominent article that basically suggested that we were spreading deadly propaganda about statins. I've never said don't take statins. I'm always about transparent communication of risk and informed choice, and that's really the crucial thing. But there are many public health successes that we need to think about to give us hope for the future through public health advocacy, and this is really something that we need to acknowledge and understand and accept and learn from, so we can also overcome the obesity epidemic. And if we do that, if we take the science and we're advocates for it and we're not afraid and we collectively speak out, then we can get this across the world. We can reverse the obesity epidemic. And I think that the evidence tells us from a scientific perspective that could happen very quickly, because we know in individuals, people are able to lose weight quite rapidly from various dietary approaches. Thank you very much.